Hi, welcome to this video. I am going to talk about a topic that is, I think, one of the more important topics in the world of neurodivergence, and that is quote unquote social skills. Let's take a look at this, what it means for neurodivergent people and what it means in terms of needs or help from possibly a therapy or a third party. So let's start with a quick history, and that is the history of the term social skills. So social skills in and of itself is not necessarily a bad term. It was just a term, and it existed and has existed for a long time and never asked to be villainized in any way. Innocent enough. What has happened historically, though, in the lives of neurodivergent individuals, especially autistic individuals, is that term social skills has been used to really look at autistic and other neurodivergent individuals as navigating incorrectly and needing to be basically turned into neurotypical people. So their ways, the neurodivergent ways of navigating socially, just navigating through society, not right, not okay, something's wrong, you didn't get something, and you need to come into this social skills, quote unquote, program or training, and we're going to basically teach you over and over and over and over again how to look and be neurotypical until you get it, right? And a lot of these processes were really ableist ideas. They weren't helpful to the neurodivergent child person, and oftentimes were hurtful, harmful, lowered their self-worth, created more anxiety, just bad kind of philosophy and approach in general. So experiencing that became synonymous with the term social skills, because that's usually what those programs, therapies were called, a social skill program. And that still happens today. I mean, that's not just history. That is a big piece of bad history in terms of how neurodivergent individuals have been treated, but it still does and can occur today. So it's not just history. So that's sort of the problem with the term, is that a lot of neurodivergents hear that term and they think about those kinds of processes. You could be somebody who's using that term and you're being affirming and you're not doing processes at all like that, but the term itself is still problematic for people. I think a better presentation in terms of if a autistic or other neurodivergent person does need some help with something social related would be social navigation. So we're going to work on social navigation. We're going to work on social navigation needs, if that is something that actually does exist that the person needs help with. The idea of, I need help with some social situation, like understanding what to do in it, understanding how to deal with it, understanding how to navigate through it, is not reserved at all for autistic or other neurodivergent people. Not at all. Anybody could have a social need. Any neurotypical person, a neurotypical adult, could access a therapist or somebody else for help to deal with some social need that's going on in their life. That's a pretty, I would say, typical human experience, right? At different times, we may all need that. And maybe, you know, we get the help we need from a friend or a family member, or maybe we get it from a therapist, or maybe we get it from some other professional, right? But this is not unusual. What we need to understand about our work with autistic and other neurodivergent kids is that history that's been problematic in this way, where it's not been about just helping them with a need they have. It's been about really devaluing and degrading their neurotype. And we don't want to do that. That we know creates more harm than help. So social navigation needs are fine if they're real and they exist, and the neurodivergent child needs help with those. What we need to understand from the therapy perspective is that that is always wrapped in affirmingness. So if I'm working on a social navigation need, fine, if that's been identified as a real need, but it still should be presented in a way that stays affirming of the person's neurodivergence, affirming of the way that their brain and their system and their body prefers and knows to do things, right? So it's providing help for things that they need help with, that they want help with, because their voice should be heard in this process of deciding what social navigation needs they want help with, and then making sure that we're helping with that, but it doesn't ever go over into the direction of trying to make them look neurotypical because we're communicating the way that they navigate is bad or wrong or problematic. So I hope that this is helpful. It's sort of a brief on this topic. We really could dive into a lot more concepts and a lot more information, but it's a YouTube channel clip. I am going to put a link to a training that I do where we dive really deep into this topic and things that you need to know about it if you're going to address any kind of social related goals with kids in play therapy. So check out that training if you want to learn more. Hopefully this was helpful. Please give the video a like, and please subscribe to the channel and come back and watch more videos. Thanks.